If you're over 50 and your doctor told you at your last appointment, great news, your blood pressure is finally normal, 120 over 80, then you need to watch this video to the end. Because what's considered ideal blood pressure for a middle-aged person can actually be quite dangerous for you. I'm not saying this to scare you. I'm saying it because the data is there. A massive study published in one of the world's most prestigious medical journals followed more than 14,000 people over the age of 70 for 5 years. And the results completely overturned everything we thought we knew about blood pressure in older adults. Those participants who kept their blood pressure at a textbook level, below 120, suffered significantly more falls. Their kidney function was worse, and, most unexpectedly, the mortality rate in this group was higher than in those whose blood pressure was slightly elevated. Over the next 20 minutes, I'm going to show you which blood pressure range is actually linked to the longest life expectancy after 70, why the standard norms written for middle-aged people can actually harm a senior, and a simple 3-minute test you can do at home tonight to see if your blood pressure has dropped too low. My name is Dr. Naomi Chapelton, and this information could change the quality of your life or the life of someone you love. Right now, just leave a comment with your age and nothing else. It's important for me to see who is watching because my recommendations change depending on whether you're 65, 75, or 85. And if you've ever felt lightheaded or dizzy when standing up quickly from a chair or getting out of bed, add the word dizzy to your comment. This is crucial, and you'll see why in just a few minutes. Let me describe a situation that plays out every single day in thousands of doctors' offices across the country. A 76-year-old woman comes in for an appointment. Her blood pressure is 148 over 87. The doctor opens the computer, checks the guidelines. The target is below 130. He prescribes a pill. 3 months later, it's 136 over 82. 6 months later, it's 124 over 78. That's much better, the doctor says. Everyone is happy. But here's what happens next. In the middle of the night, this woman gets up to go to the bathroom. Her blood pressure, which was 124 over 78 in the doctor's chair, drops in seconds to 91 over 57. Her brain isn't getting enough blood. Her vision goes dark. She reaches for the wall, and she's too late. And now, we're no longer talking about numbers on a blood pressure monitor. We're talking about a hip fracture, surgery, 3 weeks of rehab, a loss of independence, about a person's life being split into before and after, all because of a fall at 3 in the morning. This isn't rare. It happens all the time. And it's preventable. If we understand that the blood pressure norms that work at age 50 simply don't apply to someone who is 75. Now I'm going to explain 3 fundamental changes that happen to the cardiovascular system with age. These are exactly why older adults need different target blood pressure numbers. First, blood vessels lose their elasticity. Over the years, arterial walls thicken. Imagine a new rubber garden hose. It's flexible and springy. Now imagine that same hose after sitting in the sun for 20 years. It's stiff and brittle. This is roughly what happens to our arteries, a process called arteriosclerosis. When the heart pumps blood into stiff vessels, they can't smooth out the pressure wave as well as young, elastic arteries do. This means the body actually needs a slightly higher baseline pressure to ensure blood properly reaches the brain and kidneys, especially when you're standing and the blood has to work against gravity. Second, baroreceptors start working more slowly. Baroreceptors are tiny sensors in the vessel walls. Their job is to instantly detect changes in pressure and signal the brain to adjust. In a young person, when they stand up, the baroreceptors trigger a compensatory response in a fraction of a second. The heart speeds up, vessels constrict, and blood pressure stabilizes. With age, these sensors become less sensitive and react with a delay. And if your baseline pressure is already lowered by medication, that's when you get that dangerous drop in pressure upon standing. Medically, this is called orthostatic hypotension. Third, medications have a stronger effect. At 75, the kidneys and liver work differently than they do at 45. They clear drugs from the body more slowly. A dose that would be optimal for a middle-aged person can be excessive for an older patient. The medicine stays in the system longer, acts more powerfully, and blood pressure drops lower than intended. This isn't a doctor's mistake, it's biology. But that is exactly why treatment goals must be different for different age groups. Now for the specifics, because the details are where the real truth lies. The study I'm talking about included over 14,000 people over the age of 70, followed for 5 years. These weren't just healthy, hand-picked volunteers. They were average seniors with diabetes, a history of heart attacks and strokes, and varying levels of physical activity. Participants were divided into groups based on their systolic pressure. That's the top number. A group with pressure below 120, 120 to 130, 130 to 140, 140 to 150, and above 150. Here's what the researchers found. The lowest mortality rate wasn't in the group with pressure below 120. It was in the 130 to 140 range. For those whose pressure was kept below 120, there were 26% more severe falls requiring hospitalization. Acute kidney failure occurred significantly more often because the kidneys simply couldn't cope with pressure that low. And overall mortality was 12% higher compared to the 130 to 140 group. The group with pressure above 150 also showed poor results, with more strokes and cardiovascular events. That was expected. But the biggest surprise of the study was that blood pressure that is too low proved to be just as dangerous as pressure that is too high. The safe zone is in the middle, and it's higher than what standard recommendations prescribe. There's a simple test. It takes just 3 minutes, and it can show whether your blood pressure is putting you at risk of falling right now. It's called measuring orthostatic blood pressure. Most doctors don't perform this regularly, but you can do it yourself, at home, tonight. You'll need a home blood pressure monitor. If you don't have one, you can buy it at any pharmacy. The process is simple. Step 1. Lie down on a bed or sofa and lie still for 5 minutes. Just relax. Step 2. Without getting up, measure your blood pressure. Write down both numbers, the top and the bottom. Step 3. Stand up and immediately, without waiting, measure your blood pressure again. Right away. Record the numbers. Now compare them. If the top number has dropped by more than 20 points, that's a red flag. If the bottom number has dropped by more than 10 points, that's also a concern. What does this mean in practice? Suppose your blood pressure while lying down is 128/80. That looks good. But when you stand up, it drops to 101/64. The difference in the top number is 27 points. This is orthostatic hypotension. You might feel perfectly fine in a chair or in bed. But as soon as you stand up, your brain doesn't receive enough blood. And that is exactly when falls happen, especially at night when you get up in the dark, or in the morning when you're rushing to answer the phone. Take the results of this test to your next doctor's appointment. This is vital information, and it's often exactly what's missing for a proper treatment adjustment. Now let's look at which blood pressure numbers, according to the latest data, are associated with the best outcomes for different age groups. Remember, these are guidelines for a discussion with your doctor, not a substitute for individualized treatment. For those aged 65 to 74, relatively healthy, active people without major chronic conditions, the optimal systolic range is between 130 and 140. This protects the heart and vessels while ensuring sufficient blood supply to the organs. For ages 75 to 84, the recommended range shifts to 135 to 145. It is intentionally higher to account for reduced vessel elasticity and slower baroreceptor response. For those 85 and older, as well as anyone with significant frailty or balance issues regardless of age, a range of 140 to 150 may actually be the safest. In this group, The priority shifts from aggressive pressure lowering to preventing falls and maintaining independence. Now, regarding the bottom number, the diastolic pressure. For older adults, it shouldn't consistently drop below 65. Diastolic pressure that is too low means the heart muscle itself doesn't get enough blood during its relaxation phase. If your bottom number stays below 60, that's a reason to talk to your doctor, even if the top number looks normal. One more crucial point. A single reading in a doctor's office tells very little. Blood pressure fluctuates throughout the day. That's why home monitoring is such a powerful tool. 2 weeks of morning and evening readings will give your doctor a much more accurate picture than a single number recorded once every few months. You might be wondering, if all this is known, why are doctors still treating according to old standards? The honest answer is that medical guidelines change slowly. The major studies that established the 120/80 norms were conducted primarily on middle-aged people. When those results were published, they were applied to everyone. There was a silent assumption that what is good for a 50-year-old is also good for an 80-year-old. But that simply isn't true. Data showing the opposite has only begun to accumulate over the last decade. And even after publication, it takes years for new data to make its way into official protocols, and even more years for those protocols to change everyday practice. Plus, there is a psychological factor. For generations, it was drilled into doctors that lowering blood pressure saves lives. That isn't a lie. It's true for middle-aged people. But it's not easy to switch to a more nuanced approach, where moderately high blood pressure in an older person is sometimes the norm, especially when there are only 15 minutes allocated per patient. This is why it's so important that you understand this difference yourself, so you can go to your doctor, not just to get a prescription, but to discuss which target range is right for you, taking into account your age, your health conditions, and your activity levels. Here is what you should do right now, specifically, step by step. First, if you are over 70 and taking blood pressure medication, buy a home blood pressure monitor if you don't already have one. Measure your blood pressure every day at the same time, morning and evening, for 2 weeks. Record the numbers. This will give you a real picture of your average blood pressure. Second, perform the orthostatic test I described. If you find that your top number drops by more than 20 points, write it down and bring that information to your next appointment. Third, honestly evaluate your symptoms. Do you experience dizziness when standing up? Unexplained fatigue? Difficulty concentrating? These can be signs that your blood pressure is being lowered too much, even if the numbers look normal. Fourth, schedule a doctor's appointment specifically to discuss your target blood pressure goals. Don't just go for a routine check. Go to discuss which numbers are appropriate for you based on your age and overall health. Bring your blood pressure log and orthostatic test results. Fifth, if your medication is making you feel poorly, speak up. Dizziness, weakness, or a sense of brain fog are not things you just have to accept. Dosages can be adjusted, medications can be switched, target numbers can be reevaluated. Now you know what most people aren't aware of, and to be honest, even many healthcare professionals don't fully grasp. Blood pressure norms simply cannot be one size fits all. A 45-year-old and an 80-year-old have fundamentally different physiology, not just a difference in age. For those over 75, a systolic pressure between 130 and 145 is linked to the best survival rates and quality of life. Anything below 120 means an increased risk of falls, kidney complications, and potentially memory decline. Anything above 150 carries a higher risk of stroke. The safe zone is right in the middle. You now know that orthostatic hypotension, that drop in pressure when you stand up, is often more dangerous than moderately elevated resting pressure. You know how to check for it at home. You understand the physiology, the stiffening of the vessels, the slower baroreceptor response, and the changes in how your body metabolizes medication. And most importantly, you now have the language to speak with your doctor. You are no longer just a patient receiving orders. You are someone who truly understands their own health. If this video brought you clarity, please write "understood" in the comments. Share this with your parents or friends over 65. This information can truly change someone's life. Subscribe to the channel. I regularly break down medical topics that actually matter for your well-being. I'll see you in the next video. But remember, this video is intended for educational purposes only and is not a substitute for professional medical advice. Blood pressure management must be personalized and based on a patient's full medical history. Never adjust or discontinue your medications on your own without first consulting your physician.